It's not just, you just walk from one hallway to the other. It has to be of sufficient intensity to improve muscle strength.
It's okay.
So you have to do this at least 5 times a week, and it has to be 60% at least moderate intensity exercise. So if you're going for physical therapy, you'll be seen for 3 times a week. It doesn't mean that between those days that you're not having therapy, you're not doing anything at your own pace. So we do give a home instruction so you can do exercises that you're already safe. You're able and safe to do it yourself. All right, so that's one of they have to be simple. Okay, so examples of the programs, these have to be tailored to your individual condition. It could be just a walking program, Tai Chi, yoga, aerobic exercise, bowling, dancing, and gardening. And these are examples of those exercises. So these are the balance exercises that we do. Obviously, we don't recommend you to do it yourself. So somebody's always there to assist. Okay, do not attempt. So, but these are examples of having the exercise. You lift your heels off the floor and hold it for 1 second, and then go back, repeat 10 to 15 times. And as I have said, you have to be evaluated for your specific need. Maybe you're already strong in those areas. These are leg raises, standing out. Anybody want to stand up right now? You're good. Okay. We're gonna do those activities later on. All right. So obviously, educational areas where we have to go one-on-one with you are these areas. Okay. Medication. You shouldn't share any of your medications with somebody, maybe your neighbor or family member. You think, oh, this one works for me I just had a cough or pneumonia, and then you give the antibiotics to somebody else. It may not be that for that person, and the dosage may not be for that person as well. So you never share medications or any pain medications whatsoever, because those medications may not be indicated for that other person. They may be taking other medications that would interact badly when taken together. So it's best to consult with your pharmacist and your doctor, with your physician, to make sure that the medication is actually for yourself and not for somebody else. Okay, environmental medication is already done, as I mentioned. Your place is already accessible for the elderly and anyone with any disability. Okay, obviously you don't do stairs because you do have elevators. So those are the things, grab bars, that's already in your facility, in your bathrooms. So some people in the home, when we do home care, we visit their house, there's so many clutters.
Yes.
Those clutters, for them who owns the home, may not be clutters for them, But to us, they're precious to them. It doesn't have to be thrown out. It just have to be in a proper place and order. All right?
Well, sometimes they have too much.
They have too much. Maybe they can donate it to charity.
They have to simplify.
Yeah. So these are the things, clutter on the floor. Of course, we have to remove it. There's stools, chairs, and staples. Go ahead, ma'am. Come on in.
There are some people
Good morning.
I have 2 big bags now on my car.
Yeah, you want to fix it.
Those are clothes of my daughters and dolls, Barbie dolls. I have like 40.
Yes, sister. Daddy dummy. Sister.
Okay. You go ahead.
She can sit in her own chair.
Yeah, you want to move the chair a little bit so you can. We have somebody stand for me. All right, guys. I'm sorry. Maybe we will have to move it. Huh?
Perhaps, can you go a little bit?
Move in the side. wanna move just a little bit over here?
Yeah.
Just,
Yeah,
just
there you
here.
go.
Here.
Yeah, you're good. Yeah, you can stay there. Thank you. Okay.
Thank you.
Okay. Yeah, she can come, yeah. She can translate.
Okay. Great. All right. Everything's good so far. Okay. All right. It shouldn't be too long. You know, we're going through this. So these are not applicable to you because it's already been done for you. Okay. So what happens if you fall? Obviously, you don't want to be in that situation. We don't want anybody to fall or hurt themselves. So the best way to do, if you don't have anybody in there, obviously if there's somebody, you can ask for help and call. If you have made alert, you can just press that button and then they can. Somebody will call you. Well, first of all, you have to make sure that you're not hurt. You don't want to move and if you already have a broken hip and actually make it worse. So what happens is if you're not really hurt, then you can just roll onto one side, be on your knees, on your elbows, and then move to a chair nearby and hold onto a chair, and that would help you go back and sit in position. And then obviously if you're still having problems, whether you're dizzy, you don't want to get up, just call for help, or you can call 911 if you're really hurt. Okay? So what can you do to prevent falling? So first of all, we have to exercise regularly. We'll have some exercises later on, and if you need to be evaluated for any conditions you have, we can definitely help you with that. So that's the end of our presentation. These are resources that you can go to, moveforwardpt.com. You can also go to our website. There are resources in there. There are links to these resources. Any questions so far? Now, right now, we're going to have a screening test.
We're gonna take this off, we can open the lights?
Oh, yeah, sure.
Okay.
Yeah. So right now, feel free if you want to take some snacks, water, juice, and fruits. You can go ahead and help yourself. And
You can come close to the tables if you like to eat now. Come much closer to the tables. Yes. Come here to the table, take your chair.
next time, we're gonna ask Marita as far as any topics you would like to us to present, and we'll be happy to come and present it to you. We're gonna demo the new
Okay. Yeah, you can.
So our agenda for today is we're gonna take your blood pressure, your oxygen concentration, your balance,
Get better over there. Everybody can get-
and if you have any questions, of course you could ask.
And all the others sit down to the other chair.
Oh, you go.
Come here, some of
You
you,
got
the
it?
others.
All right, sure. All right,
Yeah.
take your turn. You're welcome.
Come sit down to the other chair here. You can sit down here.
You? You should be around the 80. Oh, see that? see a lot of, elderly. Congratulations. We're actually the same month. We're the same month of birthday. I think July 2. Okay, so well, maybe just two. Two should be enough, right? Was there? I think.